Good morning, everyone. On behalf of Flagler Cares and One Voice for Volusia, welcome to the 2021 Health and Human Services Summit. My name is Carrie Baird, and I'll be the moderator of this session. You've joined the session titled Ready for 20,800. All participants will be muted during the session. There will be a Q&A time at the end for you to pose questions. You may raise your hand using the reaction button at the bottom of the screen, and then we'll call on you to be unmuted. You may also submit questions during the training session in the chat box, and we will answer those throughout the session or at the end of the session if time allows. Thank you to the sponsors who made this event possible: Advent Health, CareerSource, Flagler Volusia, SMA Healthcare, Magellan Care Connect, Department of Children and Families, and the House Next Door. It's my pleasure to introduce your panelists for this session: Heather Schuberg, Robin King, and DJ Lebo.
Good morning.
I think it's
morning.
You're up.
All right, DJ, can you throw up that slide?
I sure can.
Thank you. And I apologize in advance, everyone. I have a 6-month-old sitting next to me, so if she gets chatty, now you know why. All right, so I figured let's start with some really boring stuff, some basic economics 101 on a supply and demand curve for labor. This is really kind of indicating what happens when a minimum wage is dictated to the world. And so as you'll see, taking everyone back to Econ 101, this will show that if you increase the minimum wage threshold, you'll have an oversupply of labor and therefore creating more of an unemployment gap. We've seen some of this, we've seen some $15 an hour average wages or $15 an hour wages come out in some things that my colleagues are going to talk about here in a minute. But just to kind of set the stage for what we're talking about when it comes to an artificial increase to wages and how it creates a disequilibrium in the supply and demand of workforce. Moving on.
So Heather, I've got a question.
Yep.
I mean, so Florida is like the 6th state to implement the $15 an hour. Has this supply and demand played out in the other states that have put in the $15 an hour wage already? Do you know? If you know, I didn't know until yesterday that there's 6 other or 7 other states that have done that.
Yeah, that's a great question. I'm not sure if they have enough data to be able to show that quite yet. And also the pandemic has probably caused everyone to be completely out of equilibrium altogether. And I know, Robin, you're going to talk to us a little bit about that as well. But it'll be interesting to kind of gauge that over time.
Yeah. So today, you know, when you read the headlines, you can see that Buc-ee's, for example, is being blamed for, you know, driving the wage up. In doing the research for today, I learned that Target has been paying $15 an hour for quite some time, where I think it was Publix and Walmart are still at $10.50. So, you know, it's really what will they look like when they have to get up to that level as well. And, you know, there's more, there's Buc-ee's, there's Amazon, the warehouse over in Deltona that's paying $15. I think in addition to the $15 an hour, then are they full-time or part-time? And what we're seeing is that they're full-time, and they're also providing benefits. So it's not always just the wage, it's going to be other things as well. And as we go through the presentation today, we'll kind of get into that. And taking a look at the social services and the wage we pay, we definitely have employees that are in that Alice population, you know, that, you know, the question that we'll talk about is how do we raise that up? DJ?
So I think one of the things we want to do is ask a poll question here. So maybe if Carrie can push up that poll question number 1. So everybody will just click on which are you, do you know if you're frontline staff, what your starting pay is? Is it minimum wage? $8.65 to $9.99? Is it between $10 and $11.99? Is it $12 to $14.99? Or is it $15 and higher? And if you click on one of those and then submit. Give everybody a second to answer. Then once everybody has, we'll maybe put the answers up and talk about it for a minute. So right now what we see here is that we've got maybe 20% that are at that. So luckily, it seems like most of the agencies that are on the call today are not in that minimum wage to under $10. And so the first step of change that we'll see here in September, we don't have agencies that are necessarily going to be affected. And so, but you might, if you have that $10 to $11, some of that 20% of the people that are here. And then we have 40% that are in the $12 to $14.99. And so over the next 3 years, we've got agencies that are going to be affected as the minimum wage continues to increase in Florida. And then we've got several, another 40% that are $15 and plus. And so I think Heather's going to talk a little bit about compression of wages as the continuum moves forward, and then how those lower wages increase.
Sure. So, so one of the things that we talked about when we were preparing for this conversation was how over time, you will have employees who basically say, well, you've raised the wages of this bottom tier of employees. What about me? And how do you continue to raise their wage rates as well? And so you'll see this compression factor happen where you'll have this, this ramp up of additional earners. And how is that going to impact the service industry as well? And so I think we have another poll question relative to that.
We do. So Carrie, if you could put up the second poll question. Do you plan to increase your entire salary scale as the minimum wage increases?
Say hi.
Do you want to introduce her, Heather? Tell us.
This is Emma. She's 6 months old.
Looking very healthy.
Yeah, she is. She's very interested in all the people on the screen that she can see.
So did everybody get a chance to answer? So we got about a 50-50 split, right? So Heather, what are your thoughts about that?
So, one of the things that we talked about was that as things continue, and folks are forced to increase wages, artificially, that what's going to happen to what you have to do in terms of your level of service, and how is that going to impact your business? I know some folks that we asked questions to before this talk said, it's great and wonderful to increase the wage, but when your contracts for services don't increase, what happens? And DJ, I think you're going to talk a little bit about that one.
Yes, and so I'll give you a couple of examples. We have one example we can see statewide is that in the school districts, minimum thresholds for salaries for new teachers coming in have been set by the state. And so extra dollars have been given to school districts to raise that minimum threshold. And yet there is nothing being provided for the middle earners, let's say. And so there's a lot of discontent you can see through those middle earners. And then we kind of see that playing out in various school districts across the state. We can also see that as you have a compression of your salary scale, but you have limited income. So revenues stay the same for those of us that have state contracts or standard grants. Being able to continue to increase your expenses when salaries are a big portion of your expense really creates trouble. And so oftentimes what happens is you think of ways to automate your services, right? That's one of the options, is to create efficiencies in your processes. And so we have an example of that in here at the coalition. About 4 years ago, we started as a statewide initiative automating eligibility services for us here. And so what that meant was, instead of families sitting across from an eligibility counselor and walking through several questions about eligibility determination, they started doing that work online. And we went in from a statewide wait list of, I think it was about 210,000 children on the wait list. I just heard the number last Friday of 6,000. So it's difficult to know whether or not that number, that decrease, is really related to children not needing, or families not needing the service, or families having a difficulty navigating online access independently. The census tells us that we have not had a significant change. The ALICE population, the United Way research tells us that we've not had a significant change in our population for the socioeconomic needs of our families. So we don't have a belief that all of a sudden we don't have a significant need in our population. We believe that we have families who are struggling to navigate the system.
It makes sense. It's kind of like this obstacle now that has been put up. For us, it's one of the examples of automation, or at least the use of technology, putting it that way, that when our frontline staff are meeting with clients and they're doing it in the virtual world, geographic location doesn't matter. So now we don't have to worry about having so many people at each one of our sites. It's just in this capacity. But being mindful that not everyone has that access. So we have partnered a lot with the libraries and others so that they know how to get to us as well. And so that has helped to some extent. But yeah, not everybody has a smartphone or a computer or broadband for that matter.
And I think we have to figure out some way to, we talk a lot about meeting families and clients where they're at.
Mm-hmm.
And I think we've missed the boat a little bit when it comes to the use of technology. I think we've made this assumption that while there might be a lot of people who have a smartphone, navigating an online application is still difficult. I think you can have a smartphone, but still struggle to navigate an online application.
That's a really good point as far as, so the unemployment system right now, because there's been so much fraud, has a new layer added to it called ID Me. The person's supposed to be able to ID themselves. Well, again, the assumption has been made that they have a phone with a camera. So that might be one of the things that could come out of this, and just really taking a look at which technologies work for the majority. And for those that don't, what do we use for that?
So I think we talked a little bit about unintended consequences of, and that's kind of what the theme that you both mentioned right there, is that there's unintended consequences to actions that don't consider maybe the population that is being served in some of these instances. So from a private sector standpoint, it's easier for us to see automation in our day-to-day lives when we go to the grocery store and you have self-checkout, or you go to McDonald's and you do all your ordering either on your phone in advance, or a little kiosk when you get up there. And so you can decrease the amount of employees that you need in a location because of automation, and maybe easier than you can in the services industry, where you're really dealing with a population and a clientele that just doesn't have access to the same kind of advancements in technology that we see happening in other places.
And then we also have a whole nother compounded issue, which is determining eligibility and those clients that actually qualify for services. And so for us, the qualification levels are set at the federal poverty levels. And so if there is no federal minimum wage set, the federal poverty levels will not change. And if the state sets, as the state has done, is set minimum wage levels, and those minimum wage levels continue to increase, but the federal level doesn't change, we are going to most likely see this disproportionate increase. So we are concerned and believe we will see families who have qualified for services historically no longer qualify for services as the minimum wage continues to increase beyond the federal poverty level thresholds. And so I'm interested to see if some of the other agencies that we are on the call, if you guys have that same, have you thought about that? Is that one of your eligibility thresholds? Is that something that your services have to meet federal level thresholds, or is it all state level? And I think we have a question about that. We have a poll question that is, I think it's the poll question number 3, Carrie. Does an increase in Florida's minimum wage impact eligibility or access to your services? Yes or no?
So minimum wage is going to go to $10 in September.
Mm-hmm.
It will not increase next January. So now it's just on the September. So I know for us, it's going to be probably not the $10, but definitely the $15. So it's
somewhere in between. Yeah, we're probably going to see it at around $12 because we have 150% of poverty is kind of our max threshold, unless we figure out a way to change it. Yeah, so.
And it's also who we serve, if we're serving just single adults versus families, right?
So this is pretty impactful when we look at this. 80% of those that are on the phone right now believe that it will impact the eligibility or access to your services. So, is there anybody who wants to talk a little bit about that? Wants to talk about how you kind of what you think that's going to, like, have you guys started thinking about what you're going to do? Is there anything you can do about making changes to that? Because I feel like that's a fiscal cliff. We're going to have families that are all of a sudden going to lose several services if you raise your hand, we can unmute you. Anyone brave enough?
And welcome to the additional folks that just joined us.
Yes. Nobody brave enough? I get it.
Well, I think that leads into our next question about automation of services.
Mhm. Yeah. What can be done?
PJ, you said you've done your eligibility remote.
Mhm. Oh, sorry. Let's ask our next question. Have you seen a shift in automation in your services? So you might be unsure. No, you haven't. Some, yes, or you don't know. I think probably everybody's seen, something during the pandemic, but you wonder if it's going to stick around, after, we're all released back into the world, or free to move about the cabin again. Yeah.
Mhm.
That's some. Yeah, and yes.
So if there's somebody brave enough to talk about their yes, I think that would be a good topic for us to kind of noodle on a little bit. Because when we talked about this as our working group, it was, to be honest with you, my initial thought was it's going to be really hard to automate some of the services that folks provide. So for example, if you're in a substance abuse rehabilitation facility, you're dictated by how many people you can serve in that population. So you need one counselor for XYZ number of people. You can't automate that. And so that's, how do you automate in other areas that can offset places where you really have no choice but to have a physical body be there, and to assist with how you're providing your service level.
I know that we look at McKinsey's reports a lot to see where automation is anticipated now. Given the comment was made earlier, who knows what this is going to look like post-pandemic, because we fast forwarded by 5 years. But they have healthcare social services. Most apt to be automated is processing data. And then the other two are the collection of data and any predictable physical interaction. But that human connection you cannot automate. And so, DG, when you were talking, it sounded like that your eligibility going online was not your choice. That was the state.
Yes.
So I'm wondering how many other things are going to be driven more by the state's automation.
Mm-hmm. Yeah. So we have Michael Hall. Hello, everyone. I'm in a clinic in Daytona, and have to keep my camera off. One of the things we've automated was to allow clients and patients a way to make their own appointments for our free STI testing program. And so making their own appointments, has that been successful, Michael, do you think? And have the clients been able to navigate the system to do that effectively? Incredibly successful. So I think those are the kind of things where I think whenever you can find pieces of your system to be successful, I think is always good. One thing I know we found pretty successful is professional development. In childcare, we're always looking to improve through learning. While you might think that delivery of some systems, we already know what we need to know about child development, but in all honesty, it changes every day. We learn something more, we learn something new. And so there's a new way to improve the quality of childcare every single day. And so it's really important that we continue professional development for our teachers in our classrooms. And we used to ask teachers to work a 9 or 10-hour day and then come to a training at night. And that's just exhausting. And so what we found is that online training supports are really effective. But then we do now a virtual, we call them communities of practice, where we have basically a Zoom meeting like this, where after you've done a professional development training, we get together and we talk about what that training is, what your experience is, and how you're going to implement it in a classroom. And that's what really solidifies the training. And that's when you really take the ideas and you commit to each other how you're going to implement it in the classroom. And so we found that those have been the stepping stones to really creating an effective online training. Just taking the online training can be helpful, but aren't always don't really help you implement them in the classroom.
That's fabulous. I mean, I know for us or for me, I've always said I'm not an online learner because I don't like learning in a bubble, to have that interaction. So I do have a question for Michael, that you said that you've automated how your patients are scheduling their appointments. Was that a software program that you purchased, or is that something that you developed in-house specific for your needs? Because we were talking about earlier, how some of these entities think they're doing a good job, but they're not.
Oh,
online platforms.
And maybe, will you be unmuted? Can you talk? If Harry unmutes you.
Hi, good morning. Can you hear me? Okay, yeah, we used Microsoft Teams for like a platform, MS Bookings. And so what that did was allow people to manage their own appointments. So that took about an hour each day for us to take calls, make the appointments. And then when people would have to change appointments, they would have to call us back. So that took a huge chunk out of our day. Once it was automated, the clients and patients could, control when they came in, and if they needed to change it, they could just do it themselves. So it was really, really successful. And we're booked out until the middle of June for those. Yeah, sorry about that.
If they set their own appointments, they come, like, what's your make rate? Like, do they come to the appointment?
We have about a 75% appear rate, which is really good, I think.
Is it better than it used to be?
Yeah, well, we actually just rolled this program out. Okay. So when we rolled out the self-appointment bookings at the same time. So yeah, it freed up our front desk, it freed up us, and it allowed people to kind of take control of their health and get them in that mindset.
Sure. One of the things I'm hoping would kind of come out of this as well is for maybe us to teach each other the programs we've learned or how to manipulate. For us, it's right signature. So, and again, the state didn't drive it, but the fact that they accepted it was tremendous, that we don't have to have a wet original signature. So right signature was something in our budget as opposed to like DocuSign. And even yesterday, learning how to use that better so that it's not necessarily the sequence, that it could be sent to groups of people so that other people could sign it. But our clients have loved it. I always use Oak Hill as the example. I don't have to have someone come all the way up from Oak Hill just to sign a document and send it back. And then I think it also helped with our team, that they knew that they were more accessible, that they didn't have to make someone come all the way up here just to sign something. So
I think what we can probably see is that automation of services can have really good benefits, and I think it can have unintended consequences. And probably what we need to do, probably for all of our agencies, is really pay attention to what's happening. You know, if we, and so probably, and what we're doing internally is for eligibility is we're trying to reconnect with, if we see somebody who started an application and seems to not be moving forward with it, we reach out personally to them and we try to connect with them, invite them into the office to complete the application and walk them through it. So we're trying to reconnect on a personal level with them, you know, whether it's circumventing the concept of a complete online system, you know, might be the case. But the idea is that, you know, more importantly than anything, we want families in care, you know, and if an online system is not going to be the right thing for that family, we still need to meet that family where they are. And if online isn't where they're at yet, we need to help them through it. And so I think whatever your needs are, those unintended consequences, we have to probably, no matter what, with the increase in wages, we still need to have a few employees available to help those families that are struggling with the automation. Would probably be the best way of putting it, I think. And so for those of you that, you know, are still moving towards automation, I'm sure that you're working through that as well, just like we are. And then I think one of the things that Robin was going to talk about a little bit is the external opportunities and some of the training and things that they have available too. So Robin?
Well, so when we've talked about once you've gotten your employees and they're the right fit, how do you keep them from going and chasing some of the other jobs that have the higher wage and more benefits and all those other things? I took a look at the numbers in the social services. Our turnover rate is over 11%, where the rest of the industries it's around 9%. You know, so having that conversation with your employees on why. So actually, if there is a poll question, what are you doing to actively retain your employees? Because the comparison of our wage in the social services to all the other industries, we're at maybe 60% of what others. So more time off, which I know is one of the things that we do, and sometimes it's just an hour here, an hour there, or mental health days, which I think we all used this last year. For those who marked incentives, so incentives being that there was something established at the beginning of the year. If they met certain goals, then you would pay that incentive, is how I envision incentives. So if someone wants to talk about the type of incentives that they're doing, I would love to hear a little bit more about that. Either raise your hand or put something in the chat.
So Michael Hall said year-end bonuses.
Okay.
Is that when the agency does well, performs well, like meets their goals? Yeah. So I think that's good. Gabrielle, the poll only allows selecting one, yes, but we're actively employing raises, incentives, and looking to modify PTO, yes, and permanently remote. We should have added a permanently remote option. We should have added that as an option, Gabrielle. Thank you for bringing that up. I think that's another thing that is a employee incentive for lots of employees, is allowing them to work remotely, either some or all of the time.
Because our workforce has learned that they can work from home successfully. And there are a lot of options out there now that and I'm going to use T-Tech that's in the plaza where our office is at, that they were looking to hire over 300 people and they would supply the computer. Now, we've been doing job fairs during the pandemic. Their job fairs were where most of the people registered and attended, where some of the others, we've just had handfuls of people. So there are definitely options, and talent is now global. Doesn't have boundaries on it. So, and this is a conversation we're having with all industries as to what type of employer are you? Are you one that talks to your employees and asks what they want? You know, we did a survey years ago of not-for-profit employees, and what they wanted the most was development. You know, and going to what DJ was saying, development, I think, whether it's personal, professional, same person, right? It's a lot more accessible and maybe not as expensive, but again, if they actually attend, so sometimes learning in this environment isn't the best for all of us. And so having that follow-up conversation afterwards, what you learn, how do we apply it, and those kinds of things. Some examples that we've heard, we have a landscaper, for example, he talked to his staff. They wanted to know better finances. So he had someone from finance come in just to talk about savings and some general stuff, but also specifically how to save and get a mortgage, because that was their goal. And nothing builds wealth faster than owning your own home, right? So that was how they did it. We had a manufacturer there. They had a lot of young parents, and so theirs was around paternity and maternity leave. You know, so it's going to depend on what your employees are looking for. Thanks for attending, Michael. But it's not always an easy conversation, but it's one that you need to have. And because once you have that talent, you don't want to reinvest in training more or new. So how do you keep them? And being mindful of that. I think we're kind of coming up on question and answer period, Carrie.
I think we have one more poll question, our very last one, which is, why do your employees work for your company?
Well, that's right. That wasn't in that last thing I had brought up, so.
Yep.
Was your add-on.
Yep. I can tell you, one of the surveys that we the survey that we do the most, or that we do for employees, is the Gallup 12, I think it's called. And I think that's been probably my favorite. We've done different kinds of surveys over the 10 years, 11 years I've been here. And I like that survey the best. It's pretty easy to understand. And I think it gets to the heart of employees' feelings. And I got that from Healthy Start. I got the idea from Healthy Start years ago, and I really have liked it. And we've been using it for probably 5 years.
Is that the one that's in First Break All the Rules?
Yes.
We've been using that same one for years as well.
Yeah. So if you've not seen it, you can just look up Gallup. I think it's called Gallup 12. You can look it up online. It'll just tell you what it is pretty easily. If you want, you can contact me or Robin, and we'll send you the list.
Mm-hmm.
But I think it's a good temperature taker.
So why your employees work for you, I'm not sure. I haven't asked them. 70%. They believe in our mission. Stepping stone to next step, feeling valued and appreciated. We invest in their development. So for those who marked that they feel valued and appreciated, how do you know that?
Mm-hmm.
Question.
I mean, is it something you either surveyed, or is it something you asked, or you something specifically do? I mean, we're always looking at better ways to increase morale or boost morale or keep morale high.
Here, we already put the Gal 12 in there.
Thank you, Gary. I mean, I like the survey, but I like the book too because it tells you what the different responses mean. You know, one of the questions that's, you know, I have a best friend at work on whom I can rely is one of the questions. And a lot of people are like, well, who cares? Well, but there's a reason behind it. That's what the book tells you. And so doing it just in a vacuum might not give you as much benefit as you would like.
So maybe that's something that we can talk about real quick, like differentiating yourself as an organization when you're competing with outside forces at the current moment with wages. So I know you use the example of, you know, Amazon and Buc-ee's and some others that are already going to that $15 an hour wage. You know, that free economics in that they can do that. And I wonder how many folks have lost people and seen a shift in turnover to an entirely different sector in the industry. I was in a meeting yesterday and I heard that there was extreme turnover in an organization. And I wonder how much of that was because of the opportunity to earn a higher wage in a different industry in that particular area. Has anyone seen any of their folks leaving and totally getting out of the industry because of wages
So
specifically?
we're not seeing it as much because of wages as during the pandemic specifically. We had nurses leaving their employ, and nurses are very well paid. If they're LPNs, RNs, but they just did not want to deal with the stress anymore. So there's going to be some of that in play right now too, that things were just so beyond their control. And they really took an evaluation of what they needed, and that wasn't it.
I changed the setting so that everyone can unmute themselves if they have any questions or for this period of the session.
I do think there are some industries, some of the social service agencies in the industries that are, you know, more on the intervention side of our work, that the work itself is traumatic. And I do think that work can burn out staff, and it becomes difficult to stay in the work. And I think it's really can be hard, and they can leave the work, they can leave that industry because of the work. You know, the work that we do is very much on the prevention end, you know, of the, you know, our kind of life and work is really prevention oriented. And so we see staff leave. Either they want to be more hands-on with children and on the programmatic side, or it's for pay. You know, we get great staff who we just can't pay enough money, you know, and they're phenomenal and they deserve more money, and they can go find it someplace else, and we wish them well, but I wish I had the billions of dollars, you know, but
You know, as you're saying that, DJ, I'm wondering if there's going to be certain positions that are mutual among some of us that we could share.
You know, that's a really good point. We know, you know, we have some positions that are so desperately needed that, you know, finding good quality staff is hard because of the pay. You know, the IT type, the database administration, those type of things, that data, those data types, those are so critical, and they become more and more critical as we try to make decisions based on data, but they're expensive. Those are expensive positions, and trying to figure out how to afford them, again, on a limited income is very difficult.
We've been looking at the same. How do we afford the data analysts that we need? Yeah.
And I'm sure others have that same problem, and then you start to have more and more sophisticated equipment to manage, especially as you have remote staff, as you have remote systems, as you're using online systems, you need more and more sophisticated equipment. And so you need more and more sophisticated staff to handle and manage and maintain that equipment, because 10 minutes, Carrie and I talk about this. If I have 2 minutes of downtime on equipment, I'm about up a wall. I don't handle that well. My Outlook went down last evening for 20 minutes. I'm pretty sure, things were not going.
For us, we want to hire people that are going to be empathetic and can work well with the clients that are walking through the door. And then we say, by the way, here are the 4 state databases you have to know and learn and be very, and heaven forbid you don't check a box you're supposed to check, and then they get monitored and yeah. So.
And isn't it hard to have both skill sets, to be extremely empathetic and, a great listener, and be excellent and be able to check every box and be extremely detail oriented? Those are difficult skill sets to have both sets of in the same
Left
person.
and right brain.
Yeah.
And we've even, looked at, we segregated it for a while. Well, that failed miserably. So, just still looking at how do we build up those skill sets.
Yeah.
How are you doing on time, Carrie?
We're good. We have 13 minutes left.
Gabrielle?
Well, I was just going to say, the other thing that's hard, we all have limited resources and likely multiple databases and multiple state systems they have to be in. And, I'm sure everyone's run into it, and we certainly have, where, you spend 2-3 months training somebody and getting them on all of these, which also require fees and that sort of thing, and then they're not a good fit, and it's not you're lucky if you can figure that out in a couple of weeks, but a lot of times it's more like 60-90 days. So anyway, there's that aspect of it as well.
Right.
It all just plays into the good fit. It's tough to find a good fit and the right skill set.
I do say we use CareerSource to help us with pre-testing on some things, to help us know ahead of time, to do the best we can to know ahead of time.
So we don't call it testing, it's assessment.
Assessment.
And we have a full list of prove it assessments.
Love them.
Would be happy to send you the list so that you can take a look to see if there would be something that would work in your screening. Because as much as we can do up front, because you're right, especially when they say, well, you shouldn't then harp on someone's lack of skill, but build on their positive skill. Well, we have limited resources, and we need people that can do multiple tasks. So
they have to know how to use Outlook. Like you basically, you can't have somebody, in today's world, we can't hire somebody that doesn't understand the basics of MS Office, right? And so I love that we can send them through the assessment at CareerSource, and we don't even look at them if they don't make it through that, and it's kind of this base level criteria for us. And then we have some accounting ones. And so if we're going to hire somebody in the accounting department, they have to have these base level criteria that it really does help us and give us this sense of comfort that we don't have to trial and error on the job.
And there's some things in there about customer service too, aren't there?
Yes, there are. Yep. And we've loved it. We've used it probably, I don't know, at least 5 years I've been. We've been
So,
using
and
it.
again, it's a no-cost service that's available to every employer in our community. So if anyone listening want to learn more about that, be happy to have that conversation.
Mhm.
Are there any more questions or dialogue you'd like to have with the panelists today? Well, thank you for attending this session. I'm going to add a link to the event website so that you can easily navigate back there to be prepared for your next session. So let's see, got some everyone.
Bye, Emma.
Yeah, bye, Emma. Thank you so much for joining us today. And later today, we'll be prompting you to submit an evaluation of the event. So please take a moment to do that. You can head back to the main platform and be prepared for the next sessions that start at 10 o'clock. Thank you all for joining us.
Thank you.
Thank you.